All right, I'm so glad you've decided to join me. I promise you, you will not be disappointed. We're going to talk about how to finally end your autoimmune nightmare and really what makes us different from every other doctor you've seen. There are two main reasons. One is we treat patients metabolically and neurologically. You've ordered this DVD because you or someone you love is suffering from rheumatoid arthritis, Sjogren's syndrome, lupus, scleroderma, Hashimoto's, multiple sclerosis, celiac disease, Addison's, pernicious anemia, myasthenia gravis, or Raynaud's syndrome. I'm here to tell you that we leave no stone unturned to determine the exact cause of your autoimmune condition. There are ways to support your immune system metabolically to reduce the symptoms so you can reclaim your life. Metabolic treatments are based on specific lab panels, a thyroid panel, complete metabolic panel, a lipid panel, complete blood chemistry with autoimmune differential. We can assess your thyroid, adrenal glands, liver, kidneys, white and red blood cells, and gut function with the above tests. Everything can be affected by your chronic health condition, and all of these systems and organs and glands can affect your autoimmune condition and be affected by the autoimmune condition. By addressing any problems with your thyroid, adrenal glands, blood chemistry, or gut function, we can help you heal faster. The complete metabolic panel also allows us to check your blood glucose levels, since glucose and oxygen are needed by the brain to function properly. We do sensitivity testing. This test determines if you have a sensitivity to gluten, wheat, rye, oats, and barley, milk, eggs, yeast, and soy. Now, if you are sensitive to any of these food groups, it's literally driving your immune system, making your autoimmune condition worse. If you have the following symptoms, you could be suffering from sensitivity to gluten, soy, milk, eggs, or yeast. Some of these symptoms are chronic pain, chronic fatigue, frequent indigestion, being bloated after you eat, frequent loose bowel movements, or even constipation. The only way to find out if you're suffering from any of these sensitivities, quite simply, is run the test. We can further test your adrenal glands with a test called the Adrenal Stress Index. It's a salivary test, much like a DNA test. Your adrenal glands are your stress organs, meaning that they react to stress. If you've been or are currently under stress, this test is a must. If you suffer from insomnia or blood sugar issues, this test will measure your cortisol levels. When your body's cortisol levels are abnormal, you'll suffer from insomnia and or problems with your blood sugar. Cortisol levels can be corrected via a specific nutritional protocol. Of course, we do immune panels. As you know, an autoimmune disease is where your immune system attacks a particular area of your body, like your nervous system, your joints, your connective tissue, or your thyroid gland. So we test for specific antibodies to determine if you suffer from an autoimmune condition. See, the immune panels give me an in-depth picture as to what exactly is happening with your immune system. If you're suffering from an autoimmune disorder, it trumps everything, and it has to be the first thing we address. Your immune system has two parts, Th1 and Th2. We need to find out which part is working overtime and driving continually, and which one is not working enough. Only then can we successfully treat your specific autoimmune condition. We do run a test for H. pylori bacteria to determine if you have any GI-related problems or gut function problems. We use intestinal permeability test to see if you have leaky gut syndrome. Leaky gut syndrome is described as a condition of altered or damaged bowel lining, which is caused by antibiotics, toxins, poor diet, parasites, or infections that can lead to increased permeability of the gut wall to toxins, microbes, undigested food, to waste, or larger than normal particles or macromolecules. Hormone panels. We can check hormone panels to determine if you suffer from low testosterone if you're a man, or low estrogen, progesterone in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and increased or decreased physical stamina. Inflammation. We may need to do or check for inflammation. We do this by looking at the homocysteine levels and levels of C-reactive protein. We use glutathione in our treatment of all autoimmune conditions. Glutathione is literally the mother lode of all antioxidants. Glutathione cannot be taken orally in pill form because the body won't absorb it. But we've seen miraculous changes in our patient population as a result of our specific glutathione protocols. Glutathione is especially helpful with autoimmune conditions. Now let's talk for a minute about the neurologically based treatments that we use. First of all, oxygen therapy. Oxygen is fuel for your brain and nervous system. Your brain and nervous system need two things to survive. They need fuel and they need activation. Fuel comes in the form of oxygen and glucose. By using oxygen, we help you heal faster. By using exercise with oxygen therapy, we can increase the firing to the brain. By increasing the firing to the brain, we help all kinds of autoimmune conditions. The brain-based therapy we use may include, in addition to oxygen therapy, vibration that fires up the back part of the brain called the cerebellum. One of the functions of the cerebellum is to control the spinal muscles. We also may use auditory, visual, olfactory, and caloric stimulation to increase the firing of the brain. We use non-surgical spinal decompression. This creates negative pressure in the discs and helps remove or pressure off the nerve. It also provides a slow stretch of the muscles which fire up the spinal cord, again increasing the firing to the brain. But once we've run all the necessary tests to determine your specific condition, we can successfully treat you via proper neurological and, of course, all natural metabolic or nutritional protocols. But I want you to ask yourself a few questions. Number one, how has your autoimmune condition affected your job, your relationships, your finances, your family, and other activities? What has it cost you in time, in money, in happiness, and sleep? Where do you picture yourself in the next 1 to 3 years if your autoimmune condition is not taken care of soon? What is it worth to you if we could improve your condition? Well, here's what you do next. If you're serious about the possibility that there could be an alternative treatment for you or your loved one, call my office at 205-467-2500. Tell the staff person that you're interested in setting up a free consultation and case review with me. There is a 30-day time limit on this, so you need to do that within the next 30 days. Hopefully you'll do it now. After the 30-day time period, you're still welcome to come in. Unfortunately, the normal fee will apply, which is $350. I feel so strongly about stopping the advancement of these conditions that I do open the doors to you and our community just for a limited time. We do the complete consultation, which again is a $350 value, but I only see 5 patients a month through this offer, so you may want to call us right away to reserve a time slot for your evaluation. I am a preferred provider for Blue Cross, Blue Shield, United Healthcare, Aetna, Viva, Cigna, Medicare, HealthSpring, and many other companies that are health insurance companies. But I look forward to seeing you in our office where we can evaluate your condition. I do want to thank you for your time and attention. I do wish you the very best of health. God bless.